Hello, my name is Stephanie Amaya, and I'm 24 years old. I'm a transfer student from Santa Monica College, and I came to Cal State Northridge last fall, 2017. My goal is to become a professional social worker for children, and I am programmed to graduate next spring, 2019. Now, to begin, the public health issue that I chose is simply about how prescription pain medications can lead to human beings being physically dependent and mentally dependent on them, leading them to addiction, overdose, or even causing them to die or overall death. My title of this presentation is Drug Addiction and Overdose is a Disease. The overview of the health issue, like I mentioned, is that it's when people become addicted to these medications. And according to a survey that was led in 2014 by the American Society of Addiction, 94% of those questioned reported that they switched to heroin use because prescription pain pills were harder to get and more expensive. Regarding to that, we see that medication and human beings are a big component in the health industry here in the United States. And next slide. Introduction of key terms. Some of the key term words I chose were opioids, which are a class of drugs that includes the illegal drug heroin, synthetic opioids, drugs that are available legally by prescription, receptors, which are identified as a region of tissue or a molecule in a cell membrane that responds specifically to a particular neurotransmitter, hormone, antigen, or other substance. Drug addiction, which is classified as a chronic relapsing disease that is characterized by compulsive drug-seeking use despite harmful consequences, overdose, an excessive and dangerous dose of a drug. Some of the common drugs that are used to treat pain are called oxycodone, fentanyl, hydrocodone, heroin. Other drugs that can also be addictive include Valium, Xanax, Adderall, and Ritalin. Oxycodone, genetic name is oxycodone hydrochloride. Its brand name is Oxycontin. These are tablets that are ranging from 10 to through 160 milligram tablets. 60 and above are opioids that are used for tolerant patients. It's an opioid drug used for the management of moderate to severe pain, usually for extended time period. Some of the common side effects of this drug is constipation, nausea, stomach pain, loss of appetite, vomiting, sleepiness, etc. Fentanyl, which is a strong opioid that is similar to morphine but 50 to 100 times more stronger, is used to treat patients with severe pain due to cancer or to manage pain after surgery. Fentanyl is administered through an injection, transdermal patch, or even tablets. Fentanyl increases dopamine levels in the brain, which leads to producing a state of relaxation and euphoria. Some of the side effects are vomiting, nausea, confusion, and constipation. Hydrocodone is an opioid that contains a narcotic pain reliever called hydrocodone and a non-opioid pain reliever, acetaminophen. This combination medication is used to decrease moderate to severe pain. Hydrocodone works in the brain to change how your body feels in response to pain. Acetaminophen can also reduce fever. Hydrocodone in a tablet has 10 milligrams of has 325 milligrams of acetaminophen, 10 milligrams of hydrocodone. In an oral solution, it has 7.5 milligrams of hydrocodone and 325 milligrams of acetaminophen. Next, the severity of prescription pain medication addictions and overdose. So some of the data that I found is that CDC shows that doctors began increasing their prescribing habits for opioids in the 1990s to help patients treat moderate to severe pain. In the years following 1990s, prescription painkillers rose above marijuana as most recreationally used drug by teenagers. And according to the statistics from American Society of Addiction Medicine, 52,404 people in the US died from lethal drug overdoses in 2015. So as we see here, doctors in the 1990s prescribed habit for opioids in order to treat patients that were in moderate to severe pain, and it led to after the 1990s, it led to painkillers being the highest of drug use by teenagers, leading to overdoses in 2015. The higher rates in certain areas are, according to the CDC, reveals that states in the South and the Midwest has double the mortality rates due to drug overdose. The increases in mortality rates tend to be higher in rural parts of the country. So in cities, CDC officials have found that the rates of abuse are higher in low-income populations, and many of these people rely on Medicaid to fund the prescriptions. So as we see here, that the prescription drugs, are mostly used in cities where there's a lot of people crowded, and low-income people because they benefit from Medicaid and can easily get those prescription medications. The statistics that I found is that a 2016 study showed that the U.S. veterans are at higher risk for drug addiction and overdose. In 2015, more than 250,000 adolescents in the U.S. were currently using pain medications that were not prescribed to them, and 122,000 of those adolescents reported having an addiction. Next, the number of overdose deaths among women also increased by over 400% between 1999 and 2010, while the rate among men in the same time period increased by 237%. So in this slide, we pretty much see that people who are involved also in drug addiction and overdose would be veterans, U.S. veterans, would be adolescents, and women and men, mostly men, and women are increasing their percentage as well. Some pros and cons of prescription drugs is that they cure life-threatening diseases like high blood pressure, high cholesterol, or even cancer. They can save lives and help a person live longer in most cases. Some treat minor illnesses and make it easier for a patient to live with and tolerate the sickness. Some cons would be a patient can become addicted, dependent on a drug. Teens and adults can, in many cases, prescription drugs that were not prescribed to them and misuse the medication. This can lead to dangerous injury or even death. Some of my recommendations for addressing drug addiction would be healthcare professionals, clinicians should do the right exam and measure correctly the amount of prescription medication given to a patient. The patient should be seen at least twice a month to be examined to make sure everything is going well. Physicians should balance the medical needs of patients that can be more likely at risk for misusing a medication leading to addiction. For patients, my recommendations would be that first, they need to understand the risks that these medications have. They should follow directions. Patients should always be aware of having other interactions with alcohol while taking a prescribed drug medication orally. Patients should never change the amount of dosage given to them. Patients should never let anyone else try their drug medication. All of this, I would relate it to chapter 19 because it talks about mental health. And the title of chapter 19 is Public Health Includes a Healthy Mind. That comes along with the addiction, the overdose that many of human beings have because they're mentally dependent on them. So in chapter 19, it said that mental illnesses can be caused by chronic diseases, injuries, and most importantly, substance abuse of tobacco, alcohol, and other drugs. The lifetime prevalence is 35% substance disorder. Males have more impulse control and substance disorders. Populations younger than 60 are more likely to enhance it. Southeastern states have the highest levels. And lastly, 1 in 6 Americans takes a prescription drug for mental health issues. The end.